This is your thumb metacarpal, and these are the carpals. So thumb metacarpal is associated with carpal in such a manner so that they can give you a movement in this direction as well as in this direction. So these joints are called as. Hello Bandhugan, Namaskar and welcome back to my YouTube channel Sahil Educations, and today we'll be discussing about bone joints. So basically this is very important topic, one of the important topic which comes under the NEET curriculum, and bone joint से बहुत सारे क्वेश्चंस आते हैं, एटलीस्ट वन क्वेश्चन हर साल आते रहते हैं. लास्ट ईयर द क्वेश्चन केम फ्रॉम द सैडल जॉइंट पार्ट, एंड अभी हम लोग देखेंगे कि बोन जॉइंट्स एक्चुअली कितने तरह के होते हैं. इफ़ वी डिवाइड द बोन जॉइंट्स एज पर द स्ट्रक्चरल एंड फंक्शनल बेसिस, ऑन द बेसिस ऑफ स्ट्रक्चर एंड फंक्शन, we can divide our bone joints into three types. One is fibrous, cartilaginous and synovial joints. So what about the fibrous joints? Fibrous joints are basically immovable joints. These kind of joints can be present in your cranium. These kind of joints are present in between your tibia and fibula. These kind of joints are present in between your radius and ulna. Apart from this fibrous joint which are immovable, there is another kind of joint which is cartilaginous joint. So these cartilaginous joints are basically not freely movable, slightly movable joints are the cartilaginous joints, and these joints can be present between the vertebrae. And that means the vertebral bones of your spinal cord, or you can say the vertebral column, not exactly the spinal cord. So vertebral column has vertebrae, and between these vertebrae you can find the cartilaginous joints. Let's come to the actual point, which is synovial joints. So synovial fluid is present in between these joints, and these joints are basically freely movable, and you can find these kind of joints in your appendages. Synovial joints are divided into 6 parts, 6 types or 6 kind of joints basically, or you can say that the synovial joints combined together, and synovial joints are there are 6 synovial joints, 6 important synovial joints which are present in our body. One is the pivot joint, and then ball and socket joint, hinge joint, gliding or plane joint, saddle joint, and condyloid joint. So if we talk about the pivot joint, so pivot joint is present between the atlas and axis. So which one of the bone of in your body is atlas bone and axis bone? So if we talk about the C1, that means cervical 1 is the atlas bone and cervical 2 is the axis bone. So what is this cervical bone? If you talk about your vertebral column, your vertebral column has various kind of bones. One is the uppermost bones are the cervical, which is 7 in number, then thoracic, which is 12 in number, then it comes lumbar, which is 5 in number, then comes sacrum, which is 5 in number, and you can say that the coccyx, which is 1 in number. These 5 bones are fused basically. So you have these kind of structures in your vertebral column, and your vertebral column has 7 number of cervical bones, and among those 7 number of cervical bones, the C1 and C2 can be named as atlas and axis respectively. So next talk about the ball and socket joint. That means you have to make, or you have to have one ball kind of structure, and upon that ball you have to go for a socket like structure. Definitely 2 bones, one of them must contain the ball and another bone must contain the socket. So if we talk about the socket, which is present in the scapula, and the socket is socket's name is glenoid cavity. In case of your pelvic bones, the socket's name is basically the acetabulum, and acetabulum is associated or attached with the head of femur, whereas the glenoid cavity is attached with the humerus head, the head of the humerus. If we talk about the structure here, let's suppose this one is the scapula. This one is the scapula, and this part of the scapula is acromion, and here you can find a cavity like structure. This cavity is called as glenoid cavity, and this is the socket. This is going to play as a socket. And the humerus, so if we talk about the humerus bone here, so this one is the humerus. So this one is the humerus. So humerus has a head like structure. So this head of the humerus is going to attach with the glenoid cavity of the scapula. So this kind of joint is called as ball and socket joint. Next, coming to the hinge joint, that means you definitely have seen the hinges present in your window, in your doors, that the door is moving in single direction, and it is not allowing you to go for a long angle. So when we talk about the hinge joint, we talk about the elbow and knee present in our leg, elbow present in our hand. So this is the joint which is called as a hinge joint. It is very easy, and this kind of joint is made up of this kind of joint is present in between the radius ulna and the humerus. In case of legs, you can say that the femur bone and the tibia fibula present beneath has the hinge joint. So tibia and fibula is present like this, and here the joint is hinge joint in case of your leg. So talking about the gliding joint or a plane joint, so gliding joint basically allows you very slight movement, not very free, though it comes under the synovial joint, as the synovial fluid is present in between these bones. So this kind of joint you can find between the carpals and tarsals basically. So the head of the carpals associated with each other like this, and they allow you the movement in this direction. Okay, so these are the gliding joints. So where the carpals are present basically and the tarsals are present basically, so carpal is present at this region, you can say at this wrist region. The wrist, your wrist is made up of basically the carpal bones, and in case of your leg, the ankle is made up of ankles. Just above the ankle you can find the tarsal bones. So talking about the condyloid joints, so condyloid joints are present at this region, the radius and ulna associated with your carpal bones. So this joint is the condyloid joint. In case of your leg, these kind of joints are present between the tarsals and the tibia fibula. Let's talk about the very important joint, that is a saddle joint. Saddle joint is basically a joint which is present between the thumb metacarpal and carpals. So basically this is your thumb metacarpal. I'm putting these pens here. This is your thumb metacarpal, and these are the carpals. So thumb metacarpal is associated with carpal in such a manner so that they can give you a movement in this direction as well as in this direction. So these joints are called as saddle joints, and these are the unique kind of joints. Upon this saddle joint, the last year 2023 NEET question has come also, and so this is all about the joints present in our body, basically the joints which comes under your curriculum in case of a NEET or in case of your boards in 11 and 12. So thank you very much for being with me. See you soon.